There are over 17,000 new cases of spinal cord injury in the United States every year, about 1 in 5 of these occurring in someone under 20 years of age. Spinal cord injury is one of the leading causes for use of manual, non-powered wheelchairs. Manual wheelchairs provide much needed daily mobility, but unfortunately this often comes at a significant functional cost. Because the shoulder did not evolve to meet the repetitive, weight-bearing demands of wheelchair use, there's a high risk for shoulder injury and pain. This can lead to compromised mobility and decreased quality of life. Fascinatingly enough, there is a big difference in a wheelchair user's risk for developing shoulder pain based on how old they were when they experienced their spinal cord injury. Up to 84% of manual wheelchair users with an adult onset spinal cord injury experience shoulder pain, while only 48% of adult manual wheelchair users with childhood onset spinal cord injury experience such pain, despite a greater duration of manual wheelchair use. Finally, shoulder pain is least common in children who are manual wheelchair users, where still 26% will experience shoulder pain. This means in the best case scenario, more than 1 in 4 manual wheelchair users in a given age group experience potentially debilitating shoulder pain. Up to 100% of adult manual wheelchair users with spinal cord injury will have shoulder pathology identifiable with imaging, such as thickening of the rotator cuff tendons. We don't yet know how common these pathological findings are in children with spinal cord injury. My doctoral research seeks to uncover the prevalence of shoulder pathology in children who are manual wheelchair users and how to better predict which persons with spinal cord injury are most at risk for shoulder pain. We are attempting to untangle the disparities in shoulder pain outcomes between those with spinal cord injury occurring in childhood and adulthood. We're using ultrasound, the same safe, low-cost medical imaging technology that's used to look at babies in pregnancy, to measure two-dimensional structural features formed by the bones, muscles, and tendons of the shoulder. Some of these structural features are linked to shoulder injury risk in adult manual wheelchair users. So I'm using a novel combination of clinical and quantitative ultrasound methods to determine the prevalence of pathology in children with spinal cord injury and identify objective parameters that might predict that pathology. This work will provide insight regarding the impact that use of a manual wheelchair has on the development of shoulder structure in children with spinal cord injury. We hope to learn how to better diagnose and prevent or proactively treat shoulder injuries in these children to improve their quality of life and maintain their mobility. Thank you.